So this is the Sustainable Healthcare Award, and with me is Alice Hughes, Deputy General Manager, Imperial, and Brendan Milanis, Respiratory Head of Services, Imperial College Healthcare NHS Trust. And this is the North West London Sleep Medicine Services and Imperial Health Impact Lab. And I've got even more here. NHS West and North London ICB and the Sleep Medicine Services. So congratulations.
Thank you.
I'm really interested to know what the problem was.
So in the sleep service, if patients are referred in with query sleep apnea, they would be invited to come to hospital where they would collect a sleep study and they'd meet with a physiologist who would explain to them how it works. They would then go home with that kit. They would sleep at home with the kit, and then the following day they would bring it back in, drop it off again with the physiology team, and then await their results. We were quite constrained by our physiologist availability to be able to meet with patients to explain the sleep studies, and we found that the demand really exceeded the capacity that we had available. So the problem was patients were waiting a lot longer than they should have been for access to diagnostic care.
This is very much about sustainability, and it's how did you begin the process?
So I think always going back to what's good for the patient, what's making it difficult for the patient, and we noticed that with so many journeys to and back from the hospital, back to the hospital to get the diagnostic kits, and it also ended up in a lot of non-attendance. So what we looked at is how can we make it easier for the patients, and this is kind of like it was sustainable because we posted the kit out. It was a cheaper kit, it was a reusable kit as well, and that's how we made it more sustainable, by reducing the non-attendance, by reducing the travel to and from hospital. So it was a win-win situation for patients and us.
What's been the feedback?
I think it's been good. We haven't got actual formal feedback yet. We've been looking for that, but we haven't really got much of a response, and I think sometimes when things are going well, that's okay. Definitely the other way around, we had a lot of complaints beforehand because the waiting lists were so long, and now we're seeing patients having their diagnostics well within our DMO1, so definitely complaints have gone down. Because
it says here that you have reduced the outpatient waiting list from over 3,000 to below 1,000, which NHS England will be thrilled about, by the way. But it is also, what I like about this is you're looking at two different things, aren't you? You're looking at the issue for the patient, but you're also dealing with the high carbon intensive outputs. I'm really intrigued at where you even got this idea from.
A lot of collaboration with a lot of different people. So we knew that we needed to approach this situation differently. We knew that patients were waiting far too long for access to care, and we knew that the expectation for patients to come into hospital on 2 consecutive days to collect and then return their sleep studies meant that we weren't accessing all parts of the population. We also knew that all of those journeys to and from hospital was going to be having a really negative impact on the environment. So there was a lot of different aspects of this which meant that we knew that we really needed to drive some meaningful change. So we worked together with a lot of different teams, with Curable, who's the provider of the sleep study, in partnership with our green team and sustainability team within Imperial to understand the environmental impact of the work we were doing, with the clinical teams to understand what was appropriate for the patient, and then also with our senior executive colleagues with their support for reducing waiting time. So a massive collaborative effort with a lot of involvement from a lot of people.
Well, that's been a theme right through this conference and right through these awards, that it doesn't happen without collaboration rather. And I know, as somebody who lives in the area, I mean, it's a vast area of London, not always very easily accessible. Often you have to drive to get there. The bus services might not be working. So you can see immediately how that would improve literally the patient journey. But what happens next?
I think there's always more ways we can improve. I think while our non-attendance has come down, it's still not as low as we'd like it to be. So I think we still need to reach out for more marginalized groups. So I think we need to focus more on that, whether it's reminding people kind of to come for their appointments. I think that's probably the next focus.
Well, I don't know what you're doing wrong, because I've had 3 messages from Imperial just while I've been sitting here saying, don't forget your appointment. It's like, no, I won't. Yeah.
Yeah, we have a very interesting population, very diverse population. We need to reach out more to them, I think, and technology is allowing us to do that. So I think that's the next step for us.
And how would you say, because all these awards are about spreading innovative ideas, so what would you say to the neighbouring health trust, to somewhere in Cumbria or whatever, this is how it can work?
I think there's so much focus, and rightfully so at the minute, on things like hospital at home, virtual wards, care in the communities. And I think that was a really pinnacle part of this project. We wanted to understand how can we bring healthcare to the populations as opposed to bring the populations to us. So I think any advice I would give is have a look at how can you provide healthcare more locally to the patient? How can we work with our community partners? How can we work with our councils and our boroughs to make patient care really accessible to people from where they are at home?
I mean, it is very much what the 10-year health plan wants you to be doing. It is the future, but it also requires leadership support. You obviously had that, but what did you say to your leaders? Say this is going to work.
So we wrote a business case to ask for some investment in order to pilot this. So we used data to demonstrate not only what is the current problem, but also if we did nothing, what the problem would look like in 6 months, 12 months' time. We then worked with the curable provider of the sleep studies and the green team to be able to quantify the impact of what we needed to do environmentally on the carbon savings, but also on the waiting times, on our compliance with the national waiting time standards. And when you present a case that has so many different benefits, and at the heart of that, the key thing is that patients will have better access to diagnostics, which will result in sooner diagnosis, sooner treatment, and just better care in general. We had really supportive backing from our executive colleagues, and we're very grateful for that.
Because it may even have seemed a strange question to ask, but if you can show that business plan to the neighbouring trust, you can say, look, we've done almost the hard work for you. You can take this, adapt it to your population needs, and present it to your executive team. Then because all of these awards, you're looking for it to be able to be spread, aren't you?
Yeah, definitely. I think if you have a problem, don't sit on it. Don't just complain about it. See, it's an opportunity to do something new, to do something different. And I think whenever you look at it from a patient's perspective, what is easier for them, it will turn out to be more cost effective, I think, very often, and sustainable as well.
Well, I mean, in terms of the figures I've got here, you've saved patients a median of 82 minutes on public transport or 56 minutes on private transport, with out-of-pocket savings of £4 to £7.15. That in itself, let alone the reduction in carbon emissions. So well done. It's very impressive. Thank you so much.
Thank you.
Thank you very much.
Thank you very much.